as we watch the numbers rise as you enter the doors to the Zoom room. We'll be getting started in just a moment. It's a narrow door, but we're watching you join us. And we're so glad you've done so. Now that everyone's here, I want to say welcome. My name is Rick Page. I'm Dean of the Larner College of Medicine, and I'm joined today by my colleague, Dr. Noma Anderson, who's Dean of the UVM College of Nursing and Health Sciences. Before we get started, we want to acknowledge the passing just this morning of Holly Miller. As many of you know, Bobby and Holly Miller were amazing supporters of health and health sciences in our community. Holly passed today in the McClure Miller Respite House. And just yesterday, I was visiting a patient in the beautiful Miller building at UVM Medical Center. In addition to their giving to the Medical Center and Health Network, they've been tremendously generous with UVM, including both the Larner College of Medicine and the College of Nursing and Health Sciences. The passing first of Bobby and then Holly is only softened by the legacy they leave and the lasting impact they've had on our community. I'd like to take just a moment of silence. May they rest in peace. And again, welcome to all of you today. Dean Anderson, we're so glad you could join us for this 6th installment of Off the Charts, a periodic Zoom webinar through which we showcase the important work going on at our institutions. And for all of you watching today, you will have a chance to be a part of this discussion. Please note there's a Q&A option on your Zoom screen. Feel free to leave a question as it comes to you, and we will address these questions at the end of the hour as time allows. I know many alumni of our colleges, both the Larner College of Medicine and the College of Nursing and Health Sciences, are watching today. We're so fortunate to have such dedicated alumni, dedicated to their patients and biomedical science, and dedicated to this place where your careers began. Your loyalty is truly inspiring, and you inspire the work that goes on every day toward the missions that we share in terms of educating the next generation of physicians, scientists, nurses, and healthcare professionals, and improving the lives of patients through patient care and research. Improving interprofessional education and collaborative practice and creating meaningful educational experiences for students has been the career focus of our guest today, Dean Noma Anderson. Since February 2021, Dean Anderson has served as Dean of the University of Vermont College of Nursing and Health Sciences. She earned her bachelor's degree from Hampton Institute, her master's degree from Emerson College, and her Ph.D. from the University of Pittsburgh. An expert in communication sciences and disorders and a leader in inclusive education and cultural and linguistic diversity, Dean Anderson is a past professor and chair of the Department of Communication Sciences and Disorders at Florida International University, where she also served as Dean of the School of Health Sciences. Before that, Dean Anderson was a chair for 10 years and on the faculty for 16 years in the Department of Communication Sciences and Disorders at Howard University in Washington, D.C. Dean Anderson has had a significant impact on the profession of communication sciences and disorders. She authored a seminal book, Introduction to Human Communication Disorders, now in its 8th edition. She's a fellow and past president of the American Speech Language Hearing Association and received their Honors of the Association Award, the highest honor given by that association, in recognition of her exceptional contributions to the field of speech, language, and hearing. Dean Anderson also received the Harvard Foundation Medallion for Multicultural Education and is a legacy laureate of the University of Pittsburgh. Whew. Dean Anderson, Noma, You're a valued colleague and partner to me. Welcome, and thank you so much for joining us today.
Thank you, Rick. I'm so glad to be here, and thank you for giving us the opportunity to honor Holly Miller.
Amazing person,
Yes.
Amazing couple, amazing family.
Absolutely.
So, Noma, I thought it was fascinating. You grew up in Durham, North Carolina, where I arrived as a first-year college student a number of years ago. What impact did your home have on your career?
I think growing up in Durham was a significant part of making me who I am. I was born and grew up in Durham and lived there until finishing high school. And I was surrounded by role models in my community. I grew up in a family and a community that was so supportive. So I grew up with doctors and attorneys and educators and college professors, bankers, pharmacists, entrepreneurs. And it was interesting that they encouraged us, the children, their children in the community, and they had high standards. And so they expected us to succeed, and they even expected us to be leaders. There was a lot that they instilled in us. And I don't think that I would have had the drive that I have if it weren't for my parents and the community in which I lived. And my parents were very much wanting me to see role models. And so they would take me to see leaders and entertainers and theologians and politicians who would come to Durham. They would come either to Duke or to North Carolina Central, and I would be the little person in the room taking all of that in. So I think Durham was I owe Durham a great deal in that community.
What an amazing experience. Now, what did your parents do that gave you the vision to follow in their footsteps or follow the lead that they gave you?
I think about that a lot, particularly when we are having generations that are so challenged and disengaged. And I've often thought, well, what made the difference in my generation? And I think it was the stories that we heard. As an example, my great-grandmother had been a slave and she died when I was 13. So I knew her throughout my childhood. And her son, first generation out of freedom, was the first Black doctor in the state of Florida. And Florida A&M University has his medical bag in their museum. And so then my father had to go to a boarding school because education in his hometown in Florida ended for Black children in the 6th grade. So at that young age, he went away so he could have an education. And so both of my parents went to Florida A&M University, and then my dad went to the University of Michigan and became, we think, the third Black actuary in the country. His sister said he was the first, but he wasn't. He and my mom say that he was the third Black actuary. And my mother was an educator. And she was making sure that I recognized the privilege that I had. And she would often let me know that there was responsibility that came with this privilege. And even without hearing that, I saw that from my parents.
They lived that.
They lived that. They were community leaders. They were involved in church and civic organizations. And so that's where I got the drive, I think, to be a leader and to have responsibility for others. And thinking about them, I remember when I was in the 6th grade, my father took me out of school and we drove to Raleigh-Durham Airport because President Touré from Guinea had come to Durham to see a community of Black achievement. He was the first elected president of Guinea. So he came to Durham to see this community. And so we watched them depart, and then my dad was driving me back to school, and I said, "Why did you take me out of school?" And he said, "I wanted you to see a Black president."
Wow.
So that was the kind of
First Black president.
that was the first that I got to meet. Yes. So they were instilling that in me, and I know that's where I get my drive from. Plus, I was the only child, so I had no choice.
So these bankers, these physicians, these actuaries, and all the rest, what prompted you to go into academics and specifically go into speech and language pathology?
I'm not sure what about Durham did that, except we were encouraged to succeed in whatever we wanted to do. But what led me to speech language pathology was actually Helen Keller. When I was young, Helen Keller would be very often on television, and she would be with her teacher.
Who was the teacher?
That's my story. Thank you for saying that. There was Helen Keller being so dynamic, but the interviewer would say something, and the teacher would sign it in Helen's hand, and then Helen would sign in the teacher's hand, and then the teacher would say with a response. And I wanted to know who the teacher was. I wanted to know who taught Helen, Mrs. Keller, to do that. And one day, the interviewer said, Mrs. Sullivan. And it was like, I got the name. This was before.
It was a movie.
Right, yeah. And it was before that. It was before the movie. But I was kind of like, every time I would see it, I wanted to know who that was. So, because I thought the movie was aptly titled, it was a miracle worker. And so that's what encouraged me to be a speech language pathologist.
It's so funny because I think in the medical world, so much, I'm a heart rhythm specialist because I was assigned to see a case where they were operating on a heart rhythm. And these experiences in our youth can really direct our entire professional life.
I completely believe that. And when I think about the role models that were with me and my interest and passion for equality and social justice, Helen Keller was a social activist, and so she spoke on social issues. And I would be listening to that and understand, just in awe that this woman who could not hear and could not speak was aware of social issues and would communicate about them. And then my parents were very much involved in the civil rights movement, and they would take me to demonstrations, we would participate in economic boycotts, and we took a bus from Durham to go to the March on Washington in 1963. So all of that social activism was a part of what I think became Noma today.
Wow, it's an amazing story. So then the leadership concept was, it sounds like it was preordained. And here you are, you served as chair, you served as dean twice, as I counted. Three times? Okay. So I think I've only got one in me. What's your philosophy about leadership now that you're in a position where you can really, you oversee a huge portfolio here at the university?
I think my philosophy about leadership has evolved, particularly based upon the positions that I held. You mentioned that I was department chair for 10 years at Howard University. And then as I think about what my leadership style was, it was more of what they call a coaching kind of leadership style, in that we were a team of what, like, I would try to recruit, as we all do, like the brightest minds. And so I was fortunate to do that. And we were a team, and we had a shared vision. And there we had the mission of educating these students and making them the best practitioners, and to be advocates and to be leaders. And with this group of faculty that I had and staff, it was merely a matter of nurturing and guiding and working as a team. So I always saw myself as a coach. And it was the way I got that position was really interesting. And I think they saw something in me that I had not seen in myself, because we became a department, the program became a department. And there was an heir apparent, the program director, and I was fine. And I did not know that the faculty went to the dean and said, we want Noma to be the inaugural department chair. And when I learned that, I was very surprised when I took on that responsibility. So then when I worked with this group of people that had faith in me, I realized that it was an opportunity for us to really work together and make something magnificent out of that. So while we were there with all of us working together with this vision, we educated more African American PhDs in speech language pathology than any other university, I say in the nation, they say in the world. But the only way that could have been done was with a team and me guiding these magnificent faculty. Being a dean, I'm not at the grassroots level. I'm not on ground zero with the faculty. I'm a step removed from them, a step removed probably more than one, from the students. And so that coaching is not the style that I use. It's more about setting a vision and what I call a democratic leadership style, so that everyone participates in decision making, everyone has a voice in what we say. So my leadership style is to make sure, hopefully, that everyone feels respected and everyone feels valued, so that we are working together towards this mission that they really have to implement. As a department chair, I was in the mix, but being this far removed, the work is done by so many others, and you can't be successful, I don't think, without recognizing what you owe them and giving them the assurance that you believe in them and you value them and you respect them.
And the department chairs are critical to our success. As deans, we're only as good as the sum of our departments. And it is interesting because you've got a college of nursing and health sciences. You've got a department of nursing. You're not a nurse. I've got a department of obstetrics, gynecology, and reproductive medicine, and I'm not an OBGYN. And you need to be able to provide that respect and guidance of the group. And it sounds like your first chair job, you came up through the ranks and were surrounded by people who sounds like they already knew and loved you. Then you came here after another move along the way, I guess it was. And I'm interested in how you look to apply your leadership style and your overall vision to the circumstances you found here. Now, you knew our provost already professionally.
Right, yes.
Wondering what you saw as the opportunities, how we were successful in recruiting you here, and also what you see as the priorities and mission for your college today.
Okay, that's a lot.
That's a lot.
In that question. What attracted me to the position? I had an opportunity when the deanship you didn't mention was University of Tennessee Health Science Center, being dean of the College of Health Professions. And I did that for 5 years. And then the president of the University of Tennessee system asked me to be his special advisor for diversity and inclusion. And I did that for 2.5 or 3 years, the system with 6 campuses. So it was time to move on from UT Health Science Center. And I was semi-retired, but looking for a job because I missed academia. I wasn't ready to walk away from it yet. And when I heard about the deanship from a colleague who contacted me from Washington, D.C., actually, a former student of mine, and said, I think I found you your job. And I said, where? And he said, University of Vermont. I said, you've got to be kidding. I had come to University of Vermont years ago. The provost now, Patty, had a grant. And so I would come and give cultural competence, cultural diversity lectures for a grant that she had. But that had been so long ago. And I looked it up on the website and I said, well, I think this job does describe my passions because it was obviously health sciences and being a dean. And when you read about UVM and our common ground and our commitment to social justice, environmental justice, it just seemed like the perfect next step for me that I could put together in a meaningful way, hopefully, the things that are important to me professionally and as a person. And so that's what intrigued me about coming to UVM. And what I think I bring to the position is having been a dean in 2 other places, but each one is so different that of course, you take some skills and insight from one to the other, but each is so very different. But still, having been dean at 2 universities and understanding, working with administration and making sure that I'm the spokesperson for my unit to administration, so that I have gained from those prior experiences. So when I arrived here, I think I was looking for stability, and I think the college was looking for stability. So we had a meeting of needs at that point because the provost, who had been the dean, was now the provost, and they had had an interim dean for 19 months. And so I was coming in.
Who was also acting as dean.
He was
right. College of Education and Social Science.
Right, he was the dean. Yes, exactly. I don't know how he did that. Sometimes I say 18 months and he said 19. Do not take that 1 month from me. And so I think the need for stability and permanency was something that we were all looking for. And they welcomed me in a way that was so unique because I started February 1, 2021. So I met everybody via Zoom. My friends in Memphis said, you have to move your Zoom and you could just Zoom from here. I said, no, it won't work like that. But I would come into WOW every day, and I was so impressed by the number of people who Zoomed me to welcome me and making sure I was okay. And so I just thought people were very welcoming, very, very committed to this university and to their students. And I loved the way, this is the first place I had worked where people within the departments worked well together. In my other universities, great people, great programs, but very siloed within a college that was rather diverse. But here, there were genuine friendships across the departmental lines, shared interests across departmental lines. And so I saw here the potential to really promote interprofessionalism, which is, I think, what our college could really model for other universities across the nation and the world, because we've got everything we need right here. We have most of what we need right here. More resources will make it a lot easier. But there is a commitment here. And so I saw this interprofessionalism occurring within the college. And then once we got from behind the laptop screens and the Zoom screens and meeting each other, the way that our colleges have interacted has been honestly unique for me, in that working collaboratively versus in competition with a college of medicine, as an example. So I think we can do more of that, but the way that we are included in so much of what you do means a lot for our students to work together, for you and I to work together, which I really have enjoyed. So I think what you asked me was about what was great about being here. And I think it is the potential, the interdisciplinaryism that I see here, I observe here, and the potential for it to be even more. And so this has been a career move that has been quite unique and very rewarding and very fulfilling.
And it, the way people collaborate at this institution is really special. And I certainly have enjoyed your being part of the dean's group, and the deans, we're all in different colleges and schools. We have commonality in terms of running schools and colleges, and that was something that surprised me as I arrived, as well as just how the group kind of supports each other.
We do.
And the partnerships are strong. You mentioned the interdisciplinary perspective within your college. Tell me your thoughts about interprofessional education as being something you and I agree is vital to both of our colleges. And what are the answers there? How do you think we're doing, and what can we do better?
I think we're making wonderful first steps at it, because the first step is, I think, the recognition of the importance of interprofessionalism, and we have conquered that step. Then you begin to operationalize it and understand the opportunities, and you have to create opportunities, and that's the difficult part. Scheduling is always the demon of interprofessionalism. It's not that we don't want to work together, but finding how and when to do that. So what we have done in the College of Nursing and Health Sciences, I know you've done it as well, is we're beginning to carve out time so that our students can interact together around matters that cut across all. We're beginning to look at healthcare economics as an example. We have looked at what would I call it? Systems of inequity in healthcare as a group, and beginning to develop minors that will bring students from the various programs into these minors and work together. Another interesting lever that we have is our integrative health and wellness program and the health and wellness coaching. And that interests students in all of our disciplines. And so that has been a wonderful lever for us to learn and to actually work together. And that's an interest in your college as well, and in the hospital. And so it's finding the levers to use and the time to do it and the resources to do it. But I think we are working towards that in a meaningful way. So baby steps.
Yep. And we share a simulation center.
Thank you for mentioning that. Yeah, absolutely.
And
we owe a lot to you for that.
When I was learning, and when you were in school, I imagine that we were more separated. And it's kind of nuts that doctors learn to become doctors, and then suddenly they're out working with speech and language pathologists and nurses and technicians and other therapists and more, and we're not doing as much as we can and should yet. But that's certainly a shared vision of ours, because we'll make better healthcare workers by understanding and showing the respect and really taking best advantage of the interaction and the special skills we all have.
Right.
Now, if I can shift for a moment, and you mentioned, and I think it's really interesting I didn't know much about Durham, the city itself, when I was a college student arriving at 18 in Durham at Duke, and in a bubble that I think the institution has broken down.
Yes.
Because it was very much a bubble away from the community, which is really a shame, and we missed out on the richness that we would have encountered. But there you were in an environment with a large Black population of executives and leaders, and then you go out in the world, and let's face it, in your profession and mine, we struggle with the fact that our diversity level doesn't match the country in which we live and the patients for whom we care. So share with me, if you will, your perspective on why it's important for people of color to be in health professions and lead in health professions.
I will share this with you in terms of, I'll be happy to talk about that. You talk about a cocoon. I was in a cocoon. And then I went.
In what way?
In that supportive community. Right.
So even the Black community?
No, just the Black community cocooned us so that we could be butterflies. And they nurtured us. And so I went to college and I wanted to integrate, be a part of that movement. And I was not prepared for what students of color face when they go to a majority White institution. And I always say I was the poster child for student success, just a poster child. And I got there and my brain stopped working. I wasn't smart anymore. I couldn't think. I couldn't study. And what was the most damaging thing, you kind of expect the students to be whatever, but what I was not accustomed to was the faculty. The faculty were not welcoming, had the underlying message that we shouldn't be there. And whatever I did, it was always a C, whatever I did. And it was just amazing to me how my brain just shut down. And so then, and I kept that within me in terms of how difficult academia can be. And I had a revelation one day. It's like, I'm getting out of here. I'm just transferring. And so, because I said, my parents would say college.
This was what stage in terms of your?
It was my freshman and sophomore year in college. Wow. And my mother had said, you'll make friends for life at college. And when we did make some friends, when their parents would come, we had to act like we didn't know each other. And so my mother had said, friends for life. And I thought, I'm leaving. And so that's when I went to Hampton. And my department, and I got smart again. And the
way you put that, obviously you were smart, you stayed smart, and you were smart after, but you didn't, in that environment, you didn't feel like there was support, and you felt like you withdrew.
I withdrew, and my brain didn't work. I was not smart. I went there smart. Something happened and I wasn't smart. I would read and nothing would come together. It was just a different cognitive experience that
It was a different environment.
It was a different environment.
Different expectations for you. You give this history. You were expected to be who you are.
Exactly.
When you're a kid, and the community around you, of course, she's going to be dean. Right. But you found yourself in an environment that wasn't providing that kind of support, and the data actually show that. It's
going to see the decades later, I've read, but the brain shuts down.
Yeah.
And that's what I experienced. So I understand how important it is for students to succeed. And it's so important for people of color to be in healthcare because it improves health outcomes. And you just remember when you were in a different situation. So when a patient or a family sees a healthcare practitioner that they can relate to, there's a trust factor that kicks in. I remember the first time I went to a white doctor, a white gynecologist.
And your doctors had been Black growing.
None of my doctors have been Black. All of them have been Black. And so that was very unsettling and uncomfortable. So when you see a person from your community who's providing care to you, there's a trust factor. And then the data, and then you become a role model for those patients and those patients' children, and you show them that if I can be a speech language pathologist, if I can be a nurse, if I can be a doctor, a dentist, you can too. So you're showing others what possibilities there are. And there are data that just show such poor health outcomes when there is a difference in the race, even between patient and doctor. I've shared with you previously about being born a very premature baby. And my mother would say when the nurses came into her room, she thought they were coming to say I had died. You read the literature and it shows, and I think about myself, that newborns who have white doctors die 3 times the rate of Black newborns who are treated by Black doctors. That was in the literature in 2020. And I realized there I was in Durham, North Carolina at the Black Lincoln Hospital, surviving. There are language barriers that can occur when people are being treated by others who are not from their community. Just yesterday on NPR, I heard a talk that I hadn't even thought about elderly Hispanic individuals in nursing homes and SNFs, and the language barrier. It has a negative impact. Exactly.
Now, what's wonderful is you're helping educate the rest of the world, and I know you've given some webinars on micro and macro aggressions in academia and healthcare settings. Any further recommendations on how we can address health disparities and hopefully make it so that in addition to having a more diverse healthcare workforce, educate everybody so that they give outstanding care to everyone in their care.
That's a message that I always give. The responsibility doesn't rest with those of us of color. The responsibility rests with everyone. Have to be allies and advocates. Education is the number one, with cultural humility. And very often I say, there's a little voice that comes in your head and you have to train yourself to not listen to it. You'll meet someone and you may have a negative, it happens to all of us. Everybody, the implicit bias, and you have to turn, sometimes you always say, listen to the inner voice, and these instances, turn the inner voice off. Because then you train your brain to think in a more equitable way, and you're more aware of the biases that all of us have. Yeah.
So I'm going to shift gears for a moment, and then we're going to be able to take questions from the audience. I was kidding when I said we had all day. We've only got an hour. I wish we had more. You alluded to resources, and yes. I've never been at an institution, tell me if you find one, that has too many resources. But we here have done an amazing job traditionally with limited resources, but resources are even getting more limited, and the expenses are only rising. How can philanthropy help you and your College of Nursing and Health Sciences?
I think that philanthropy can help us just stay a little bit ahead, well, just to keep up with the state of the art. I think that I worry about us not having the capability to keep up in terms of the technology that is needed to educate students. You talked about a sim lab.
Anatomy lab, our dream anatomy lab.
Our dream anatomy lab that costs a fortune. Everything.
$10 million to take care of that.
Exactly. So educating our students with the technology that's available helps with student success. So that's what I would love to have. We're all worried about student indebtedness, and so being able to help with student scholarships. But for the College of Nursing and Health Sciences, audience, a building, we need a new building. It is an old building that we cannot do much with. And so we are really, the faculty and the students and the atmosphere and the love that are in that building make up for the deficits of the building. But I just dream about how we could just soar if we had more resources and a new building, that would just be wonderful.
Great. Yeah, the opportunities are endless. And at the same time, it's amazing what we all do with the facilities we have.
Yes,
and we
yes.
continue to aspire to even greater things.
Yeah.
Thanks for sharing that. Now, during the time we've had together, we've been able to collect some questions. Those of you at home can't see the scores of people behind the cameras who helped put this event together. Among them is Dan Suter, our Associate Director for Alumni Relations, who's on the other end of the Zoom and chat and emails. And Dan, would you please share with us the first question?
Sure. Thank you, Dean Page. Thank you, Dean Anderson. The first question, what are you doing in your colleges to teach students how to keep humanism in healthcare?
You're the guest.
Excuse me. I think what we're working on that in a more deliberate way now than we had previously. All of us in colleges and universities across the country are concerned about the health and wellness and the well-being of our students. And so we are helping our students be able to deal with the stress of academia, because we know that when they enter their chosen fields, there will be additional stress. And so being able to look at how they are functioning here and to look at with humanity, the people with whom they'll be working. I think there could be a number of definitions of humanism. So I'm hoping I am addressing what the caller is thinking about. But it's certainly something that we're all working towards, because it improves student success, it improves their own development as humans, and certainly the health outcomes of our patients.
Yeah, and just to build on that, in medicine, there's always talk traditionally about the art and the science of medicine. The science changes every day. The art stays the same in many ways, and that is focus on the patient, focusing on core values. In medicine, there's a Dr. Gold who started the Gold Humanism Society and that's one of our honor societies. The Gold Humanism Society started the concept of the white coat ceremony, which now you have white coat ceremonies, and I didn't have a white coat ceremony, but the focus on what the white coat represents. In our college, as you're aware, we have our focus on professionalism, and professionalism in some circles has almost been weaponized inappropriately as you don't look like me, or you don't talk like me, or you don't dress like me, and that's unprofessional. That's not what we're talking about. And if you go around our entryway, you'll see our statement on professionalism, where we emphasize cultural humility, kindness, and respect as being characterizing our daily interactions, what we aspire to. We're not perfect. None of us is going to be perfect, but to continue to focus on the humanism within the various health sciences and medicine. It's critical. It's better outcomes, and it's what our patients deserve.
Well, I smile every morning when I come in the door to WOW, because there's a sign right at the door that says humans for humankind.
Very
And
nice.
I see that when I walk in every morning.
Very nice.
Thank you so much. Dean Anderson, what is the future role, in your view, of advanced practice nursing in healthcare?
You know, I think that's a great question, because there are not enough nurses. There is such a shortage of nurses. The same thing for physicians. There's not enough physicians. And so we're always looking for healthcare extenders, and nurses that want advanced training just elevates the level of care, and it elevates the professionalism. It's a win-win situation. I think there is a tremendous future for advanced nursing. We've got to be able to craft those experiences for what hospitals need, what clinics need, and what the nurses want to have. And so we've got a dynamic doctor in a DNP, doctor in nurse practice program with 100 students in it. There are perhaps 480 undergraduate students, and then 100 in our DNP program, and it's growing and growing. And so there's a need for advanced practice, and just extending healthcare is the goal.
And if I may jump in, I had clinic on Tuesday, and I send a note to the care providers who refer me patients and with whom I share care. And a significant percentage are nurse practitioners who deliver primary care. We don't have enough primary care providers in this state or in this country. And these individuals represent part of a group that is providing primary care as well as more specialty care, and in my case, heart rhythm disturbances alone. And I can't imagine being a primary care provider today for all they're doing. Nurse practitioners and family medicine and internists. It's hard work, and we need more of them. So
Absolutely.
100 in your class is really going to help our state and our region and our country.
And I'm glad to hear you say that, because it's so important that people recognize the need. And one of the things we're very proud about in the College of Nursing and Health Sciences is that a number of our faculty have a primary care clinic, a DNP primary care clinic, where our DNP students are educated. And it's in the community, and it is a wonderful primary care center in a community where our faculty are providing those services, and our students are there as well.
Thank you. There was a related question which you both touched on about enrollment numbers at the College of Nursing and Health Sciences and the Larner College of Medicine as they relate to specifically meeting Vermont's needs for primary care providers. Could you maybe add on to what you just said relative to plans for growing those numbers, or in general, your thoughts on meeting those needs?
Well, in our college, we have a number of disciplines, and they're all growing. And in fact, they could grow even more if we had a new building. But what we have is our largest program is our nursing program. And then we have a tremendous exercise science program with 193 students in it. And we have an emergency medical services for rural areas with 196 students in it. And so what we're doing is increasing our enrollment, and one way that we can do that is by hiring the best faculty that we can to give these students the best opportunities they can have in education. But all of our programs are growing, and that is amazing. We have about 13 of them, and they're all growing. They're all growing.
And in the Larner College of Medicine, to answer the question, we have 124 spots in the first year class. When I got here, I had the fire marshal take a look at our major classrooms, and they allowed 4 more. So we went from 120 to 124, and we kind of earmarked 2 of those new students as being Vermonters. So we are limited in our ability to grow. We also, if you think about it, this is a small state, and we have some limitations in terms of clinical sites for our students. Actually, 30 of our students do their clinical rotations in Connecticut at our branch campus. So we're limited there. I will say, though, that within the state, over 40% of our primary care physicians are either graduates of our college or graduates of our training programs at the UVM Medical Center. And somewhere around over 30% of our specialists in the state are from our academic health system. So we're doing everything we can, not only to educate here, but bring in residents who then often will stay where they train, in addition to recruiting other physicians into the UVM Health Network, for example.
Great, thank you. There's a view that healthcare outcomes can be poor and there's uneven access due to the healthcare system. What future do you see for single payer systems or other alternatives?
Rick, I'll answer that one.
Dean Anderson's our guest. If we were rebuilding the healthcare system in the United States of America, we would not build what we have, clearly. I won't go into the politics over a single payer or Medicare for all. I will say that one way or another, and we're not there yet, healthcare is a right, and every single individual in the United States, whether it's by federal, state, or private insurance, must have outstanding healthcare. Now, there also is the issue of access, and even if you have Medicaid, Medicare, private insurance, getting in to see the doctor is a challenge in almost every community, and certainly in ours. And that's something we're working every day to improve. Want to build on that, Dean Anderson, or shall we move on?
No, that was a perfect answer.
You're very kind.
Well, thank you both so much. Those are all of the questions we have from our online audience today. So I will turn it back to you, Dean Page.
Well, thank you very much, Dan. If more questions come to our audience, feel free to get in touch just through the original email you received inviting you to Off the Charts. We're here to answer your questions, and we're really privileged to have the opportunity to share this time with you. I want to thank Dean Noma Anderson. Noma, I've learned so much about you. Learned so much about the College of Nursing and Health Sciences. I remain even more of a fan of you and your college, and more admiring of the path you've taken, and seeing how fortunate we were to recruit you here. So thanks for taking the time.
Thank you for the opportunity to be here. As you can tell, I love to talk about my college. Yeah. And so thank you for this opportunity. Off the Charts, it's wonderful.
It makes it easy when you love the place you're at, and your pride clearly shows through. And for this, now the 6th edition of Off the Charts, I want to thank those in the room, the scores of you here who helped make this possible. And again, to thank Noma for joining me, and just in closing, when we close, you'll see on the screensaver a web address, which will bring you to the website for Off the Charts, where you can access a recording, you can send your friends, and you can even look to past episodes. And in closing, I just look forward to join you all again sometime in the future for the next edition of Off the Charts, and at the many events that take place here at our college, at your college and the university. Don't be a stranger, especially for all the alumni out there. We love it when you come visit, and your loyalty and generosity make us all better. So in closing, until the next edition of Off the Charts, stay well, stay safe, and thank you so much for joining us. Have a great day.